My name is Pradeep Poonen. I'm one of the GU medical oncologists at the Durham VA and through the TeleOncology program. TeleOncology care brings subspecialty care to veterans where they are and doesn't require them to travel or have connections at an academic center. We bring that level of care to them. Oncology is a field that is changing rapidly, and so specialists are able to keep up with their fields, have more knowledge of sort of the cutting edge of medicine, and we'll be able to bring that to our veterans with this approach. TeleOncology is the platform that allows us to talk to patients and give them a plan for their cancer care, which allows them to release a lot of the anxieties and fears that they've had before the visit. Veterans and providers are a little skeptical of technology, but I think with that first visit, being able to use the medium as a way to have that same interaction that you would have with patients in person, getting to show your personality, getting to see theirs and what makes them who they are. It's about as close as you can get to being there in person.
My name is Virgil Miller, and I live in Buckhannon, West Virginia. I'm the sheriff of Upshur County. I started at the sheriff's office in Webster County in 1977, right after my discharge from the military. I've been with sheriff's offices primarily for 46 years. The VA in Clarksburg, the doctors there did surgery, discovered that I had a malignant melanoma. They talked to me about telemedicine. I'm a person that doesn't really adapt to change very well, you may say. You know, actually, once we sit down and we started, the longer I sat there and the longer I talked with the doctor and interacted with him and was able to ask questions, and he was able to respond, say, well, this is what we need to do first, this is what we need to do second. I gradually understood, where he was coming from and, realized, hey, this is doable. I think the number one thing I take from it is I have the availability of a top quality physician right there sitting down, taking an hour to talk with me, and I don't see where I could get any better, really. Everything's going really well. All the test results, PET scans, CT scans, blood work, everything are coming back very well. And we're keeping on top of everything we're supposed to be doing, so it's going well. All I can say is, with my part, if you have the diagnosis, it's hard to deal with initially, but these people were trained and they know what they're doing and they'll help you through it. The VA's not sitting back on their laurels of what they've already done. They're looking at new and better ways to help veterans, and I think the telehealth is a perfect example of that.